Season finally in full swing. The Travelers Championship opens tomorrow and players are hitting the links now that, of course, that it's warming up.
Yeah, golf really offers many health benefits, but it also harbors the potential for a wide range of injuries. Dr. Nick Bontempo, an orthopedic surgeon at Hartford Hospital's Bone and Joint Institute, is joining us right now with more. Doctor, thanks for being here today.
Thank you for having me.
What are some of the most common injuries that you hear from golfers?
So usually they can strain their elbow, their wrist, or their hand. Commonly, people can develop golfer's elbow, which is something that people will see frequently, which causes pain on the inner part of the elbow.
Is that similar to tendinitis? Because I know that this is also very common with golfers. And how do you prevent that? And if you get it, how do you treat it?
Sure. So it is, golfer's elbow is a type of tendinitis. It's similar to tennis elbow, which a lot of people have heard of as well. And in terms of trying to prevent it, it's helpful just to kind of stretch before you go out, typical type of warm-up exercise that you would think of doing. And also having proper form, taking lessons or having a golf and swing analysis is helpful to make sure that you have a proper form so you don't stress the joints and the muscles in a bad way that can harm things. And if you do develop it, then there's things that we could do to try to get under control for you.
I would imagine over time these kinds of injuries can develop from, repeated movements and things like that. For a serious elbow injury, what options are available? I would imagine surgery is one of them.
Surgery is an option. Usually it is a last resort, particularly when we're dealing with tendinitis of the elbow. We usually try to exhaust all conservative measures first. And things that we do, there's a combination of braces that patients can try. There's medications, either oral or topical medications, physical therapy, which encompasses a whole broad range of modalities such as heat, ultrasound, dry needling, stretching, K-taping, and then also there's cortisone injections as well.
Is that what the recovery process is like if you do have surgery?
So if one was to have surgery for golfer's elbow, let's say, usually we want to get patients to start moving right away. But usually we have them to go back to playing golf and swinging a club in about 3 weeks or so after surgery.
Before we let you go, Doctor, I would imagine it's important for people if they're having, aches and pains, even some minor ones. This is something they should really pay attention to, right?
Absolutely. You have to be in tune with your body, listen to your body. No one knows your body better than you do. If you feel like something is wrong, it cannot hurt to, make an appointment and get checked out. The best thing that you can hear is everything's okay. And, nothing that you have to worry about. But, if something's wrong, at least you can pick it up early and treat it appropriately.
All right. Doctor, thank you so much for joining us this afternoon. We appreciate your time and your expertise.
Thanks. Have a great evening.
For more information, make sure you visit the Hartford Hospital website right here, hartfordhospital.org/B.